Welcome back. Now, early childhood development is crucial to education in later years, but studies have found major gaps in South Africa, especially in rural areas. With this in mind, the Nelson Mandela Foundation has been working to set up ECD centers, that's early childhood development centers. President Cyril Ramaphosa will open one of these at Little Flower Center in Mbizana in the Eastern Cape. That's where we find Nqobile Madlala, who joins us now for the latest. Nqobile, we did already see that the president was there giving his words of encouragement to the young people of Mbizana. What did he say about this particular ECD?
Well, the President, Masejo, just explaining that ECDs are very important. He's even saying at this point over 1.2 billion is going to be invested in the ECDs and ensuring that they're also registered. There is a concern, though, that quite a number of them are not registered, but he's saying there is a breakthrough as 20% more has been seen to be registered. So the reason why they're opening this ECD specifically is because also he committed to the specifically also giving his half of his salary to ensure that kids do get areas like this as ECDs. But he says he's worried that quite a number of these ECDs don't have things like nutrition, all sort of things that comes with ECDs that should be fundamentally easy to get. But Nelson Mandela Foundation, of course, has been on the ground and they get to see what really happens. So I'm going to bring in Samaya Hendricks now to give us an update. Samaya, the president just saying that this is very important. Tell us why.
Thanks so much for having us. Look, early childhood development, we know from the research, is an important phase. Those early years are critical for a child's life. And after looking at the research, the foundation decided in 2018 to focus on early childhood development. And we're here today to spotlight the Bangasali campaign, which is trying to massively increase registration of early childhood development centers like Little Flower ECD Center. So it's not just about constructing centers, although we are asking for support from private sectors and others, but it's really about making the process for registration easier, which is what the Bangasali campaign is trying to do.
So what are the benefits in ensuring that they are in fact registered?
Look, at the moment we have a situation where 40% of sites are only registered, which means that the vast majority of sites are unregistered. And so registration really means a system of especially for ECD centers that cater for in poor communities. Being registered means that you have access to government 17 Rand per child subsidy, which is a complete game changer in terms of nutrition and also what the center is able to do with those resources.
And of course, I understand that you are working with basic education and ensuring that all of this has been done accordingly. Tell us a bit about that relationship that you have built and what does it mean for the place that we are in?
No, we're incredibly grateful for our government partners. The Bangasali campaign was initiated with a partnership between the Department of Social Development and the Nelson Mandela Foundation, with the Department of Basic Education taking over early childhood development. It is now we have Department of Basic Education spearheading Bangasali, and we're really happy about the progress as is made, and we look forward to seeing what else Department of Basic Education is able to do in terms of really pioneering the campaign.
Thank you very much, Sumaya. I'm going to bring the Chief Director now to sort of give us an update in terms of what this means. I mean, we're hearing from Sumaya telling us that they are looking forward to ensuring that they work with basic education. What sort of investment are you going to be doing in these ECD centers, and can we expect more in Eastern Cape?
So as government, we are already contributing and investing in ECDs. We provide ECDs with a conditional grant, which is financial support from government, and that conditional grant helps them to get registered. Those that are struggling with meeting the requirements of registration, there is a registration framework that allows for a developmental approach that would allow them to walk very slowly towards meeting all of those requirements while getting a subsidy that allows the children to receive the nutrition, that allows the practitioner to receive financial support at the end of the month, like a salary, and it allows them to be able to manage their ECDs.
I mean, the president just highlighting that there's still a concern because a lot of ECDs have not been registered yet, but he's saying that there is a breakthrough as well, whereas 20% have been registered. Can you perhaps give us an update in terms of the stats? What's going on?
So the stats is as recent as the census that we conducted, which we concluded in the beginning of this year. So we have quite a high confidence about the statistics that we have shared with the sector and with South Africa and with government. We have 42,420 ECDs in South Africa, which are serving 1.6 million children. 40% of those are registered, a differential registration where some are conditionally registered and others are completely and fully registered. And of those, 33% are centers that are serving children who are being subsidized by government.
So now going forward, what does this mean for Eastern Cape and what does it mean for South Africa as a whole to have ECDs like this? Why is it important?
So this ECD that was just handed over to this community today is an example of where we want to take South Africa and where we want to take Eastern Cape. So what it means is that what we were showcasing here today was what we can do when we come together and work with our partners and we implement Bangasali as a tool that will help us to massify registration. We all know what Bangasali means. We have it in isiXhosa. It means Bangasali, no one must be left behind. So we are on a registration massification campaign. We are working with all of our partners in the sector. We are putting in as government our own financial our own funding, and the sector is coming in to augment that to ensure that we get as many of ECDs registered, because registration means that they are looking after children, and if they are looking after children, they have a safe space to look after those children. The children can be fed, because it then means that they have a step closer to getting subsidization once they are registered.
Thank you very much. That's Kulula Manona, who's speaking to us, Masego, just giving us an update on those ECDs. But basically what they're telling us is that everyone must have a fair start, and that's exactly what they were doing today. And that's just a showcase behind us of what an ECD can look like. But going forward, like what she's saying, 40% of those ECD centers in and around South Africa will get some assistance at some point.